Cancer incidence is rising in elderly populations, and urologic malignancies commonly affect older populations, especially those with bladder cancer. There are significant risks to urologic cancer surgery in geriatric patients, and these patients tend to have higher levels of competing comorbidities. These increasing amounts of comorbidities reflect frailty status, which is an individual's physiologic reserve, and can compound with common perioperative risks associated with major urologic surgery. Chronologic age is a poor predictor of health outcomes, and physiologic age or reserve is more useful in evaluating performance status. Geriatric assessments are a systematic evaluation of areas where older adults often have deficits and includes functional status, mobility, cognition, emotional status, nutritional status, comorbidities, polypharmacy, and social support, among other aging-related domains. These assessments may help risk stratify patients and can predict outcomes, as well as aid in shared decision-making. They can also help individualize recovery after surgery. The Short Physical Performance Battery, or SPPB, is one such validated assessment to evaluate 3 functional domains: balance testing, gait testing, and the chair stand. Each task is performed and scored from 0, meaning inability to perform the task, to 4, meaning best performance. Total scores range from 0 to 12. The first aspect of balance testing is the side-by-side stand, where the patient will stand with their feet together for 10 seconds. A score of 1 point will be given if successfully held for 10 seconds. The patient may move their body, arms, or knees to maintain balance, but if they get out of the posture, the assessment moves on to the next section.
We're going to do some balance tests. So first I'm going to have you keep your feet side by side parallel and hold it for 10 seconds.
The second component of balance testing is a semi-tandem stand with the heel of one foot touching the toe of the other. A similar scoring method to the side-by-side stand is used.
A semi-tandem stand, so you're going to put your heel parallel with your toe of the other foot. Not in front, but to the side, yeah. And then you're going to stand there for 10 seconds.
The final component of balance testing is the tandem stand, with the heel of one foot in front of and touching the other. 2 points are awarded if the position is held for 10 seconds, and 1 point is given if held from 3 to 9.99 seconds. If the patient cannot hold this position for 3 seconds, or they do not attempt this, they will receive no points.
The next one, I'm going to have you do a complete inline stand, so heel to toe, and then I'm going to have you balance there for 10 seconds.
The gait speed test is a course of 3 or 4 meters for time. The patient will walk at their normal speed, and the instructor will first demonstrate the walk. Patients who use assistive devices may use them during this section. At our institution, we use a 4-meter walk test. The scoring system is shown here, with higher points given for less time required to complete the course. Points are allotted for the best of 2 attempts.
All right, next we're going to do a 4-meter gait test. So this is not a test of speed, just walk at your normal pace. And I'm going to have you walk from the red tape to the green on our side, whenever you're ready.
You may start timing when the patient begins moving, and stop timing when one foot has crossed the line. The final component of the SPPB is the chair stand test. Without using their arms, the patient will stand from a sitting position. If they are able to do so, they will proceed to the next portion of the assessment.
First, I'm going to have you try to stand up from your chair without using your arms, if you can.
Finally, the patient will perform the repeated chair stand, going from a sitting to standing position 5 times in a row without stopping. Points will be awarded based on the time required to complete this, for a maximum of 4 points.
Next, I'm going to have you do that chair stand without your arms 5 times in a row.
The final scores from each component are summed to give a total score. Although not standardized, several studies have suggested that an SPPB score of below 10 may predict all-cause mortality, and patients with lower intermediate scores have higher risks of poor physical performance, loss of independence, and hospitalizations. Lower SPPB scores have also been associated with falls, sarcopenia, frailty, and postoperative complications. Geriatric patients are at a high risk of frailty. Preoperative assessments can help identify patients who are at risk. The Short Physical Performance Battery, or SPPB, is a reliable tool for a geriatric evaluation. This tool, among others, can be used preoperatively to assess geriatric patients for frailty prior to urologic surgery.